Hi, I'm Susan Moore with Spirit of Women in Banner Health. We Spirit members are so fortunate to have the most brilliant doctors to give us advice, tell us the latest things that are going on in the medical world. And our guest today is Dr. Speed, endocrinologist. Dr. Speed, thanks for being here.
Thank you. Nice to be here.
You know, is diabetes an epidemic? Do you see a lot of people with that?
Well, we do, and diabetes certainly appears to be on the increase in the number of people that have it in this country. It's gone up quite dramatically here the last couple of decades.
And what do you attribute that to?
Well, several factors. One is we've changed the diagnostic criteria for diabetes. We've lowered the glucose where we label someone as having diabetes. Secondly, I think we do a much better job at screening people. And thirdly, there have been a lot of lifestyle changes in the United States over the last probably 40 or 50 years. People are bigger, and we know that obesity itself lends to increased risk for diabetes.
And diabetes, there are two types, and I'm not sure how that works. What's type 1 and type 2?
Type 1 basically refers to a condition usually seen more commonly in children, young adults, where the body, it's an autoimmune disease, meaning the body attacks itself, and the cells of the pancreas, the beta cells that make insulin, are destroyed by this autoimmune process. So these people basically cannot make insulin on their own, and they have to be treated with insulin or they can go into a serious condition called ketoacidosis. So the insulin is truly dependent, just essential for life and management of the disease.
Well, let's just talk about that. If a child has diabetes, what would the symptoms be like?
Typical symptoms would be increased thirst and urination. A child might start bedwetting, for example, who was not doing that. And children don't typically get up at night to go to the restroom, so that would be a sign that something could be
frequent
happening.
Urination?
Frequent urination, weight loss, sometimes quite rapid. And as it progresses, if they do get more into this ketoacidosis situation, they may start having nausea and vomiting, become very dehydrated, and start abnormal breathing patterns too.
Wow. So it's pretty key to get that treated right away when those symptoms appear.
Absolutely. Hopefully before they get to that point, but sometimes if someone's never experienced that and the parents are not familiar with it, that it sometimes becomes a more pressing emergent situation.
So treatments, is it shots?
Basically it's shots. There is an inhaled insulin that's come out recently. We had one before that didn't do too well, and there's another one that's come out again that's still in its early stages, but for the most part insulin is injections. And there's long-acting insulins, there's short-acting insulins, and we usually combine them in some fashion. And
is it the severity of the disease that determines how much insulin that people take?
It does, although individuals with type 1 diabetes usually are more sensitive to insulin, so typically they need lower doses.
Okay. Well then, let's talk about type 2 diabetes.
Type 2. Type 2 is much more common, probably 90% of what we see is type 2. And that's typically more seen in older individuals. When I say older, over age 40, although we are seeing it in people younger than that. Usually associated more with obesity, and people who are predisposed to it, usually a family history. And certain ethnic groups certainly have more of it, particularly Native Americans, Hispanics, in part because of their Native American ancestry, African Americans, but certainly Caucasians have it very commonly too. Okay,
and again, the treatment for type 2 diabetes?
Treatment's a lot more varied for that. Often these people, first off, lifestyle intervention, people becoming more active, eating healthy, losing weight is very effective, but not where we're so successful. But medication-wise, there's a large number of oral medications. There's insulin is sometimes used in these people too, particularly the longer they've had it. But there are injectable medications as well. They're not insulin, but they can actually facilitate better diabetes control and weight loss.
Nice. Okay, I just jumped right into diabetes, but what else does an endocrinologist treat?
Endocrinologists basically were hormone doctors.
Right.
And diabetes falls into that realm because insulin is a hormone. And the part of the pancreas that makes insulin makes other hormones. But people don't usually think of diabetes as a hormone disease, but the things we more commonly do from a hormonal perspective are thyroid disease, the adrenal glands on top of the kidneys, we work with those, the pituitary gland up in the head that controls a number of endocrine glands in the body. We're involved with the management of those conditions too.
There is a lot of them, huh?
There is. It's a very multifaceted, especially in that regard.
Thyroid. my girlfriends, women my age, seem to be having, or I'm hearing more about hypothyroidism.
Thank
you.
Perfect. Yeah.
What's that
What's
about?
quite common, and we estimate the number of individuals in this country who have thyroid disorders is probably pushing 20 million. The most common being hypothyroidism. Hypothyroidism means an underactive thyroid, whereas the thyroid gland does not produce adequate amounts of thyroid hormone. And there's a lot of symptoms that go with it. Fatigue, weight gain, feeling cold, constipation, among others. The problem is some of these symptoms are pretty common anyway. And
Right.
there's often a rush to blame it on the thyroid, when in fact a lot of people have these symptoms who don't have a thyroid problem. So we have to be cautious in making sure it really is a thyroid and treating it appropriately.
Right. So you can't just get medication because you're overweight.
No, and the reason we don't do that, 30, 40 years ago, it was given out pretty liberally as a weight loss medicine. And the problem is when you put people on excessive amounts of thyroid hormone, there are some other trade-offs as far as it can be bad for a woman's bone density. It can promote osteoporosis and also cause heart rhythm problems, particularly a heart rhythm called atrial fibrillation. And that can be a very serious condition where people can have an irregularly beating heart and form clots in the heart and have a stroke from it.
So, if you think you have the symptoms, you should get it checked, huh?
Yes, it's a fairly easy thing to check. It's a blood test basically, and the doctor also can examine your thyroid gland and make sure there's no enlargement or lumps or other things that could be concerning as well.
All right. Is there anything else you'd like to share with our viewers and listeners that I haven't asked?
No, I think from a diabetes standpoint, sort of from a public health perspective, diabetes is often asymptomatic, particularly type 2 diabetes. So if you have a family history or in one of the risk groups, some of the groups I mentioned, or women who've had large babies who had gestational diabetes or more risk for developing overt diabetes later in life, you should get it checked. It's an easy thing to check with a blood test, and often it can be symptomatic, but we want to catch people hopefully early in the process so we can intervene and treat it effectively.
Yeah. Well, gosh, thanks for all the great information, Dr. Speed.
Thank you.
You've been very interesting. I'm Susan Moore for Spirit of Women in Banner Health.